All right. Okay. Okay. All right. I don't know what happened. So we were discussing about the history, perception. So you need to take a brief history. What happened? You have to take, basically you have to take the incident history, and after that, ask about past history, like that. Yeah, Dr. Hamid has already explained that you have to ask about PMA, Holy Family. That was the mnemonic. So you have to ask on that, and then ask about any high blood pressure, high blood sugar, previous history of stroke, any bleeding problems, any scan of his head in the past, and any blood thinning medications. Okay, these are very important. Has he ever complained of any other symptoms, or did he complain of any symptoms today? So the wife, she might tell you that, okay, her husband complained of headache. So you can ask, what did you do for that headache? And then you have to go for invitation. You have to invite. Okay, I understand he was brought here by an ambulance. After he was brought here, did anyone tell you what happened to him at the hospital? Who is in the family? Are you here on your own? If you have not checked support in the beginning, you can ask over here as well. Okay, and then I have an important update regarding Mr. Ali's condition. So would you like someone to call or
वॉशरूम जाने
be by your side
इधर आओ,
for this discussion? Okay.
इधर आओ।
ठंडा हो जाएगा लॉलीपॉप।
Okay, so then you have to go to narrate. You will be going to knowledge part. Then you have to narrate. As you told me that he collapsed at home, he was brought by an ambulance. When he was brought here, he was still in the same condition. Then we did a scan of his head. Unfortunately, the result of the scan is not what we hoped for. Okay, I'm afraid that Mr. Ali I'm afraid, Mrs. Ali, that I don't have a good news for you in terms of your husband's CT scan. I'm really sorry to say that your husband has sustained a mortal wound in his head. Okay, so you can narrate this way. Sorry, some problem is going on. Don't know. Okay, and then you have to wait for some time. Here you have to pause, because when you have narrated this to the patient, so attendant, she might start crying, or she might react, oh God, oh, I didn't know, how did this happen? So you have to wait for her response, wait for her reaction, wait for her emotions to come, and then you have to wait. You can just use that Eve protocol. Okay, I'm sorry, I can see that you are really upset, that it has come all of a sudden to you, it has come unexpected to you. I can see that you are very upset, so I'm sorry that this has happened. So you have to be empathetic with the patient, validate her emotions, and also then you have to go for strategy and summary. You just need to wait. If she is crying, then you have to wait. Don't just try to finish the station. Okay, as long as she's crying, do not try to touch her. Just ask her, okay, would you like to have some tissue? Okay, if she doesn't respond, then just simply pick up the tissue box and keep it by her side. Okay, and then if still she is not consoled, or she is still crying, then what you can do is wait for some time and offer a glass of water. Okay, that's all what you can do. And then when she is quiet, then she will say, okay, doctor, can you tell me what's going to happen with him next? So what are you going to do for him? Are you giving up on him? So then you will be narrating, you will be telling the strategy and summary. Okay, he has been reviewed by the neurosurgeons that who are the brain specialists, and the bleeding is massive. So unfortunately, your husband is unlikely to get better, okay, or unlikely to improve. So there should be a pause again, and then you can pause, and then wait again. She might cry again, and then don't be eager to talk too much, and don't give knowledge rapidly, and do not bombard all the knowledge that you have in your mind. No, just go with the flow, okay? Wait for her to respond, and then you can narrate, or you can discuss the summary or strategy with her, okay? And then so she will ask, okay, what are you going to do for him? Then you will say, okay, so he will be offered a palliative treatment. Palliative treatment, what is palliative treatment? It is a type of supportive treatment. We will try to make sure that Mr. Ali has a quality of life, and we aim to treat the symptoms, which means we will try to make sure that he is not in pain, give him medication to make him as comfortable as possible, so that he's not struggling to breathe, and so he can sleep comfortably, okay? So that's all we can do in palliative treatment. And then she will be having some questions like, okay, how long will he live? Then you will tell, well, it's a difficult question to answer at this time, but it could be hours or it could be days, but I have to ask my senior, I have to consult my senior, and I can get back to you with the answers, okay? You can give a general answer. And then, can you take him to the ITU? If she's asking, can you take him to ITU? Then you will tell, his problem is not regarding breathing, because he has been breathing on his own. So he will not benefit from any invasive measures while taking him to the ICU, because ICU is needed only for those patients who cannot breathe on their own. So it will not bring any change or any better, it won't make his condition better, okay? So it is not recommended, it is not in his favor. And then what do you mean terminal? You have to mention clearly that your husband's condition is terminal, that we are not hoping, or the neurosurgeons or the brain specialists, they are not hoping for your husband to get better, okay? And then terminal means, she will be asking, terminal means that we are not expecting him to show any improvement or recovery. And then why did this happen to him? As you have already taken some history, then you will be able to tell, okay, the surgeons believe that he had an aneurysm. And what is aneurysm? That means that it is blowing out of blood vessels in the brain, and he is having, or he has been having, high blood pressure for past 2 years or 1 year. So he might have had burst of that blood vessel, okay? So what is aneurysm? It is basically ballooning or blowing out of blood vessels in the brain, okay? Are you planning on doing anything for him while he's here? Attendant is asking, or the wife is asking. Then you have to tell, okay, we are going to provide him with supportive treatment to make sure that he has quality of life. And then the relative asks, okay, doctor, I have 2 daughters. Do you think that I should call them? And then you have to tell, okay, yes, it is advisable that you should call them, so that you have somebody by your side at this difficult time, okay? And are you giving up on him? Then you have to respond, I'm sorry, I'm really sorry that we have given you this impression. We are not giving up on him. We are going to we are going to provide him with the treatment that is suitable for him, or suitable for his situation. All right. So in this way, you are going to answer all the questions of the wife. Okay. So now I'd like to take some questions from your side. If you want to ask any questions, you are free to ask. Okay, we have another scenario of intracerebral hemorrhage. Talk to the son over the phone. Mr. White, a 77 years old man who collapsed at home and was brought to the hospital by an ambulance unconscious. The neurosurgeons have assessed the patient and have classified his condition as terminal, and feel that an operation would not resolve the problem. The CT scan of the head was done, which showed massive intracerebral bleed. Patient is lying unconscious but is breathing independently. His son is here to visit him. Talk to the son, or either son might not be present over there. So you have to inform the son over phone that you have to update him regarding his father's condition. Okay, son is not aware that his father is in the hospital. Son does not live with dad but spoke with him this morning and he was fine apart from headache. Okay, and then you have to talk to the son and update him regarding his father's condition. Okay, so how you would approach this station? There are some questions from the son's side. Is my dad in hospital? Are you sure? Can I see my father? How did it happen? And then you have to proceed with that approach. Keep that Spikes protocol approach in mind, and then proceed with grips, greet, build a rapport, introduce, and then state the purpose or paraphrase, and then the smile. You have to do it whenever the patient is in front of you or it is face to face. And whenever you are on the phone, then what you can do is you can introduce yourself, and after that you can check identity, name, address, date of birth, and confirm phone number. And then you have to ask, okay, hello, I'm Dr. Aman, one of the doctors speaking from one of the FI2s speaking from St. Thomas Hospital. Is that Mr. Ali or is that Mr. James speaking? All right, could you please confirm your full name and date of birth for me? Thank you. And could you please confirm your first line of address for me? All right, thank you. Is it okay if I call you James? All right, James. James, in case the call gets cut, so is it the same number I can call you back on, or do you have any alternate number? So you have to follow the telephonic approach. And then you have to ask, okay, are you the next of the kin? And all those questions, you will be asking those questions. And then you have to tell, okay, James, is it the right time to speak to you, or have you got a few minutes to talk over the phone, because I have some important information to give you? Okay, and then he will be saying, okay, doctor, I'm fine, you can discuss the information with me. Or you can say, okay, James, would you like to move to a more private place, or are you okay to talk? And then if he's doing something, he will tell you, okay, doctor, can I call you back in 5 minutes or 10 minutes? I'm in the middle of something. Because they might be driving, they might be in the middle of something, so they cannot talk. So you can ask for appropriateness of the time. Okay, is it the right time that we can talk? And then once the patient has said okay, and then you have to ask, okay, is there anyone around you? Okay, you have to check for support as well. Is there anyone around you, or privacy as well? You have to check for privacy, that if the patient is in some public place, so he can move to some more private place so that you can discuss with him. And then you have to disclose the information. Okay, then here are some tips. You can say, hello, Mr. Ali, or whatever. I know we haven't met before, but I apologize if I'm talking in an awkward time. Can I call you at the moment? Can I talk to you at the moment? Is there anyone around you? I'm calling about your dad, and the reason I'm calling is to inform you that your father has been admitted to the hospital and he's quite unwell. Okay, you have given a general information. Before that, you have to confirm all those things that I have already mentioned. And then check if he's okay to talk over the phone, or is it better that he comes to the hospital? Okay, it is better, it is advisable that you ask them to come to the hospital. Okay, would it be possible for you to come to the hospital in person? So most of the times the attendants say that, okay, doctor, we are coming to the hospital. But if they do not want to come to the hospital, you can talk to them over the phone as well. Okay, I didn't know that my dad is in the hospital. Okay, it's the son's response. I'm sorry that I had to inform you in this way. Unfortunately, he was admitted to the hospital following a collapse at home. So you have started the discussion. What happened? It's the son's reply. Break news in layers and be sensitive. Unfortunately, your dad collapsed at home and he was brought by ambulance, and then narrate the story in that way and check on him frequently. How is he now? He's unconscious. And take some history. After that, take some history. Can I ask, who does your dad live with? Okay, and does he have any medical conditions? Are you the next of the kin? Have you got any other siblings? Are you the eldest son or whoever? You can ask like that, okay? And then come to the management part. Okay, he might ask, why did not you operate on him? And then you have to tell him, okay, brain specialist, you have to narrate the whole things that we have already discussed, that okay, he was reviewed by the brain specialist and they are of the view that he's not going to get any benefit, or he's not, we are not expecting him to get better. His nature of the bleed is so severe that we cannot operate on him. Normally when there is bleed, what the neurosurgeons do, the brain specialists do, they shift the patient to the theater and remove the clot from the brain. But in his case, it is not possible. So it may be better that you come and we could have a discussion in person. And if he agrees to come in, then you should ask that, okay, do you know where to come? Then you tell the address, okay, come to emergency department in Guy's and St. Thomas Hospital. How long would it take for you to reach, or what time you will be coming in? I will make sure one of the nurses to be around there so that you can find her and you can contact me. And I am doctor. You have to leave your name and contact so that the attendant should be able to contact you. Okay, I'm Dr. Imam, so you can find me or you can ask for me when you reach the A&E. Okay, this is the way you can disclose the news. And then it's an RTA in a child. You are NF2 in pediatrics department. It's basically a child with extradural hematoma. So you are NF2 in pediatrics department, Joshua, aged 9, had a road traffic accident an hour ago. Initial survey has been done and there is a head injury. No other injury has been found. CT scan has been done and showed an extradural hemorrhage. You have not seen the patient. A team of doctors is resuscitating the child and planning to take him to the theater. Please talk to the parents and address their concerns. Okay, so in this type of in this scenario, again, most of the time you will be getting type 2 introduction, type 2 approach, and that the patient, whenever you enter the cubicle, the attendants might or the relative might jump over you. Okay, doctor, tell me, how is my child? Because mothers are sometimes more anxious, so they may straight away ask you, okay, doctor. They might not give you time to introduce yourself or whatever. They ask you, okay, doctor, tell me, how is my child doing? What happened? How is he at the moment? And you can do the same approach there. Okay, I'm sorry, I beg your pardon. Can I confirm a few details before we talk about your child, or we talk about Joshua's condition? Okay, by the way, I'm Dr. Emma, one of the doctors working in this pediatric emergency department. So could you please confirm your name, and both of them will be confirming the name, and after that how you are related, or you already know that they are the parents. It's been given in the scenario, then no need to ask. Okay, so you just need to confirm so that they are the parents, and you have to just confirm it. And then you have to give them a general answer that, okay, at the moment Joshua is not doing very well. He's still unconscious, and just you have to give still unconscious. And then you have to start taking out some history. Okay, you have to, when you've started taking the history, you will be asking, okay, can you tell me when did this happen? What happened? What did you do after that? Did he collapse immediately? Did he wake up at all? Was there any bleeding? Has he had any medical problems at all? Any bleeding problem? Any medications he's taking? Okay, and has he ever had any surgeries in the past? Okay, you can ask about that. And also you need to ask about allergies, because medications and allergies are very important here, because surgeons or your team is going to operate on Joshua. So you have to ask about allergy, because he might be allergic to some medication or some other some drugs that cannot be given. Okay, so you need to rule out the allergies and ask about what was the last meal he took, what time did he take that meal. Okay, what about water? Because they will be giving him anesthesia. So post-op anesthesia complications can occur. For example, aspiration pneumonia can occur if the patient is not nil per oral. So these sort of complications can occur, so that you should be aware of it beforehand. You have saved the patient, but post-operatively patient develops aspiration pneumonia. So it is because you didn't ask about the last meal, the allergies, or the food, any water intake, any bleeding problems. Okay, because surgery is an invasive procedure. When you are going to operate, you will be needing blood as well. So you have to ask about any bleeding problems if it is there is bleeding problem. So ask these 4 questions. Is a must. And then narrate the story, ask once the mother will be telling you the story. She will go on telling you, okay, this happened, he was crossing the road and he saw his father and he would start ran away and he was hit by a vehicle and there was blood all around. You have to listen them actively and keep nodding your head, and you can just say okay, all right. And you have to react. You don't have to say anything. You can just respond. Nod your head. You can respond. All right. And then when you have listened, when she has finished, then you can tell, okay, as you already know that this happened, and then he was brought over here. And what did you do here? You have to tell them. Okay, as you know that he met an accident, he was brought here by an ambulance. After he was brought here, he was assessed by neurosurgeons. He's still unconscious and he had a CT scan of his brain. CT scan, you can explain that he had a special imaging or he had a special scan of his brain called CT scan. Okay. So unfortunately, we didn't receive a good news in terms of his scan. I'm really sorry to tell you that Joshua had a massive bleed in his brain. No need to tell him about the kind of bleed that he has sustained, extradural hemorrhage, and you don't have to discuss this type of bleeding with them. You just have to give them a general knowledge, because they won't be understanding what is extradural hematoma or extradural hemorrhage. You will be wasting your time. You just have to give a general idea about the bleed. Okay, and then you have to once you have narrated the story, the mother might cry. She might blame herself, that she might cry. What you have to do is you have to go with the Eve protocol. Okay, take some pause and then do the same. Offer some tissue or glass of water, and then she might blame herself that, okay, it's my fault and I am responsible for it. And then you can you can tell her that, okay, it was just an accident. Please do not blame yourself. It was an accident and it can happen to anybody. Okay, so you have to tell the strategy, that what are we going to do at the moment. He's being prepared for surgery to remove the bleeding. The surgery could be either something we called as burr hole surgery, in which surgeon will make a hole and take out the clot from his brain. Okay, and if this is not possible, then we will make a small window on the head and remove the blood clot. Okay, so you have explained about 2 types of surgery, that is the burr hole and this opening the calvarium. Okay, mother will be asking you, okay, can we see him now? And you will be saying, at the moment it's a matter of urgency or it's an emergency. We shouldn't delay this operation. We are our team is making ready to take him to the theater. So as soon as possible, we are going to operate on him as soon as possible. And once the surgery has been done, I will come back and talk to you and update you on his condition. And I will make necessary arrangements for you to see your child. And then the mother might have some question that, okay, will he develop any complications, permanent complications? And then you will tell, unfortunately, he may develop some permanent complications because there is a risk of damage to the surrounding structures. Okay, because of the surgery or because of the pressure symptoms. Okay, and what sort of damage? She says you have to tell, he may have some weakness, loss of sensations, and difficulty with speech and learning problems may be there as well. Okay. And then, is he going to die? Well, you have to say again, well, it is difficult to say, but the surgeons are hoping he will benefit from the surgery. So we hope that Joshua will recover from this. And we have got a team of, we have got an expert team or team of experts over here. So we are trying our best to do what needs to be done for him. Okay. This was RTA in with Joshua with EDH. Okay. And again, the same scenario, but in this case, the child is having pelvic fracture or hip fracture. You are in FR2 in A&E. Joshua, aged 9, had a road traffic accident. He was brought to the hospital. An initial survey was done. He had an unstable pelvic injury. He had lost lots of blood and he is hypotensive. Initial management was done and patient has been resuscitated. He's being prepared to go for surgery. Parents are quite anxious. Talk to the parents, discuss about further management and address concern. Exactly the same scenario, exactly the same approach. Just you need to do is you have to change this extradural hematoma with pelvic, or you can say hip fracture. Okay. Let me see. What is see? Do we need to consent from them if they are not happy with the surgery? They do. Well, Sudhan, I would like to answer your question. Well, it's a matter of emergency. So you do not need to take consent because it is in betterment of, it is for the patient's benefit. So it is emergency. That's why they brought their child to the hospital. It is, they've already, you can say that it is a form of consent that they have brought their child to the hospital for treatment. So there might not be any case that they would refuse consent for surgery. Okay. Because it is, you have explained it that the surgeons are of the view that this bleed should be removed from the brain. So yes, this bleed should be removed for when, then they won't have any issues regarding this surgery because you have discussed, you are here to discuss these things. Okay, RTA in child is the same scenario. So let's not waste time on it. And then let's go to post-op bleeding. Another scenario. This is, you are an FI2 in vascular surgery. Mrs. Janet, age 65, has undergone an aortofemoral bypass graft in her lower limb due to vascular insufficiency that caused calf pain. Okay. And she was shifted to the recovery room. She was shifted to the recovery room. After the operation, your nurse colleague noticed that she was bleeding heavily into the drain. A few hours after the operation, she was given 6 units of blood products. Your colleagues all scrubbed into the theater. She was taken to the theater for re-examination. Her husband has come to the hospital to see his wife. Please talk to him about his wife's condition and address his concerns. There was no error in surgery. This is a known complication of surgery. Consent from Mrs. Brown has been taken to talk to her husband. Okay. So this is a case of post-op bleeding where there has been bleeding aortofemoral. This is aortofemoral bypass. All right. So this is the scenario that a patient has undergone a surgery like that is aortofemoral bypass graft surgery, and she has bled heavily after the surgery, and now she has been taken back to the theater, and her husband is here to talk to you about the condition. You have to inform the husband, you have to talk to the husband and tell about her, tell about his wife's condition. Okay. And there has been important information in the scenario that there was no error in surgery. This is a known complication of surgery. Okay. And consent has also been taken from Mrs. Brown. Suppose that consent has been taken, or most of the time it is written in the scenario that consent has been taken. Okay. So how will you start it? You will start it with normal approach, do the grips, that is greet, build rapport, introduce yourself, purpose or paraphrase, and then with a smiling face or normal face. Okay. Because it is breaking a bad news scenario. So you don't have to smile a lot, but you should not look depressed. Okay, do not look depressed and be confident. And confirm relationship, how you are related to Miss Janet. May I know your name, please? And or how are you related to the patient? You can confirm the details, all those things, and then you can go. I've been asked to come and talk to you about your wife's condition. And then before discussing that, what you can do is check his understanding. Go to perception. Can I please ask what is your understanding about your wife's operation today? Signpost. Okay, I've been asked to come and update you on her condition. What sort of symptoms did she have? Did anyone explain to you about the surgery? And has anybody come and talked to you? How did the surgery go? Okay, you have to tell. You have to ask these questions. Did anyone explain about the possible complication of this type of surgery? So has she had any problems in the past, any bleeding problem, if she had any injuries or any cuts that bled a lot, any bleeding tendencies? Is she on blood thinner medication, any other medications at all? Okay, you have to ask for all those things. And did you manage to speak to anyone after the operation? Has anyone told you about the operation? How did it go? Do you have any concerns? You can ask all those questions in perception. Okay, in history taking part. That is, perception is basically check their understanding and take history from them, what they already know about the condition. And maybe the husband's reaction may be, when you are asking those questions, he may ask you, okay, I think you have made a mistake during the surgery. Then you will be responding that, okay, can I just ask what made you say that? What made you say that? Is there any particular reason for you to say that? I can explain everything to you. Okay. Then invitation. You will be telling, okay, I have an important update regarding your wife's surgery. Is it okay that we talk about her condition now? And then go to narration and give knowledge. Okay, as you know, your wife had a circulation problem in her leg. She developed pain, and therefore she had an operation today. This particular type of surgery was called aortofemoral bypass graft surgery, which means that the operation was to connect two large blood vessels in the body, one in the tummy, that is the largest blood vessel called aorta, and other in the leg, which is femoral artery. So operation was, or surgery was, to connect both of them to resolve or to bypass this problem of clots in her leg. Okay, and then so aorta is the largest blood vessel in the body, and this surgery comes with risks of, as surgery has got a lot of risks, and this surgery comes with risk of bleeding. So initially today, the operation went well. And after the operation, when we brought your wife to the recovery room, there is a room where we bring patients after surgery to observe them after the surgery for any problems after the surgery. Okay, and then one of the nurse colleagues noticed that your wife has been bleeding heavily, and then she called the doctors, and we quickly checked, and then we saw that she has bled a lot. And what we did, we shifted your wife to the operation theater. At the moment, our team, if the patient has already been shifted to the theater, you can say, okay, at the moment our team is has taken your wife to the theater, and she is being prepared for surgery to stop the bleeding. Okay, and I'm unfortunately, you have already told the patient that, okay, this unfortunate situation has occurred. I'm really sorry to tell you that she has bled a lot. You can use all those words over there. Okay, and at the moment she is in a serious condition. Okay, you have to tell them. Then pause. The husband, her husband might cry, or he may be upset, and he may be silent. Okay, expect those emotions and give them time to talk. Once they start, give some pause. Once they react or they are done with it, then you can narrate, then you can use that Eve protocol. Okay, I'm sorry that this has come to you all of a sudden and everything. Okay, I can understand that you are very upset, quite upset, and I'm sorry that this has happened. And then a relative, the husband might ask you some question. Okay, is she going to die? Then you will be answering that it is difficult to say, but she has had huge amount of bleeding, and we had to transfuse 6 units of blood. At the moment, she's in safe hands, and the surgeons are trying their best to stop bleeding. We hope that she recovers from this. Okay, and then the next question may be that, is 6 units of blood a lot of blood? So you have to, yes. Well, unfortunately, it is quite a lot of blood. And relative question will be, I'm not aware of the mistakes during the operation. I think you have made some mistakes. And answer to this question will be that, well, to my knowledge, as far as I was told, there has been no mistakes during this surgery. Okay, you can say this. And the patient or the relative might get angry. He might say that, okay, if no mistake, then what is this? You have to say, unfortunately, it is one of the complications of this particular type of surgery. And why did you do the surgery when you knew there would be a complication? Did you really anticipate this would happen? So you should reply that we did not expect that she would suffer from this particular complication, and it is very unfortunate situation that she developed this. Okay, and and the relative might ask you, okay, I have 2 children, one in London, another in Australia. Should I call them? Yes, it is better to inform them. Okay. And then what is the strategy? You have to tell about the strategy, that she has been taken back to the theater, or all the staff is working to stop the bleeding. The surgeons are trying to find out the bleeding point. So we hope that she would recover from this complication after the operation. I'll come back and update you on how the operation went. Okay. And because you have to clearly, as I mentioned in the beginning, you have to tell the patient's relative in clear words, because they might not be able to judge the severity of the condition. Because here the attendant is saying that he has some question, he has some work to do, and he's saying that, okay, doctor, I'm going to do my night shift work, because it does not understand the severity of the severity or the nature of the bleeding that has occurred. So you have to tell that we don't recommend, we don't think that it is advisable to go at the moment, because your wife's condition is quite serious. We may have to contact you at any point, and your wife may also need your support. It is better for you to be present around. Okay, you can say all those sort of things. It is the same scenario. The next scenario is post-op stroke. It is the same scenario like I have discussed with you. Post-op bleeding is post-op stroke. Instead of bleeding, you have to replace it with stroke. Okay, we just have to look into the questions. What are the questions of the attendant or the relative? We are just going to answer those questions. Okay, and you are FR2 in neurosurgery department. Gemma Walker, an 80-year-old lady who had brain operation for a space-occupying lesion. While in recovery room, they noted that she's unable to move one part of her body. CT scan of the brain was done, which showed ischemic stroke. She's now at the ITU or intensive care unit. She is awaiting to be reviewed by the stroke specialist. Talk to the son and address his concerns. Okay, you are going to talk to the son. You will be following the same approach. You have to update, you have to tell, you have to ask all those questions which we have already asked in this previous scenario. And then you have to follow that Spike's protocol, narrate the story from the beginning, from the moment she was brought here, and then what did you do, what happened in the recovery room, then what after that, what was done. Okay, and what is the condition of the patient at the moment, and what are we expecting. Oh, okay. The answer, is she going to die? It is difficult to say, but we are waiting for the stroke specialist, because it has been given in a scenario that we are waiting for the stroke specialist to come and assess her. After he assesses, assesses your mother, we will be in a better position to answer your questions. Okay, we will come back to you and discuss it with you as well. And will she be able to use right part of her body? So sometimes people recover. Some people recover. They are able to move and use part of affected part of their body, but that depends on the severity of the brain damage. But I can get more information after the specialist has reviewed your mother. Your mom's situation is a bit uh, different, because she had a brain surgery, and after the surgery she developed a stroke. Okay, so this should be your answer. And what are you do you think, is she going to recover from this? So it is difficult to say how well she can recover, but she can be offered treatment. The doctors are trying their best for the recovery. For her recovery, she is receiving the best possible treatment. That is why she has been taken to the ICU. The doctors hope that she will benefit from the treatment. Okay, and what are you going to do for her? So it has already been discussed that okay, she has been shifted to the ICU, and we have consulted the stroke specialist, and we are providing her the best possible care at this setup. Okay, and then the next is intraductal papilloma breast. It is difficult to discuss all the scenarios, so we are going to discuss it. We can discuss this scenario, this one. So intraductal papilloma, URFI2 in the surgical department. Emma Taylor is a 50 years old lady who had a biopsy of the breast done and has come for her test results. She had a routine mammography which showed suspicious changes, and then she was asked to have breast biopsy. The biopsy showed intraductal carcinoma in situ of the breast. It is very early stage of the breast cancer. Explain the results to the patient and address the concerns. Again, you have to start with same introduction, grips, do grips, and check for support, that are you here on your own today, do introduction and everything, and check for support. And then you ask about, you tell the patient that, okay, we have got the results of your test or your biopsy with us, but before that, I would like to ask you a few more questions, or to be on the same page, so that we are on the same page. I would like to ask you a few questions to have a better understanding of your condition. Okay, you can ask those questions, and then you can ask about the previous mammograms. Why did she do? What did they reveal? And after that, what happened? Why biopsy was? Why mammogram was ordered? And why biopsy was ordered? Okay, she will tell you that, okay, doctor said that I have some abnormality in mammogram. He referred me for biopsy. So then you will, when you will be narrating, you have to ask the history. You have to take history in this perception part, and after that, when you will be going to invitation part, invite the patient that, okay, uh, are you ready for us to discuss the results today? Is it the right time to discuss the result? Would you like someone to be present by your side before we discuss the results? Okay, and then you have to narrate, as you mentioned that you had several mammograms in the past, and the last one was a suspicious one, and for which the specialist or the GP referred you for biopsy, and we have got the biopsy results with us. And I'm afraid, I'm sorry to tell you that the biopsy results, we do not have a good news in terms of biopsy report. So the biopsy report reveals that you have got cancer of the breast. Okay, do not say in carcinoma in situ of the breast. No, she won't understand. Use layman terminology. Say that you have, biopsy report has revealed that you have carcinoma. You don't, you have cancer, or you have breast cancer. Okay, use appropriate tone over here. I'm sorry to tell you, Mrs. Taylor or Miss Emma, your biopsy report has revealed that you have got breast cancer. Raise your brows and raise your tone a bit and then lower it. Okay. And then she might be upset, she might cry or wait for her reaction and then pause, give some pause over here, take a pause here, and then use this Eve protocol. And after that Eve protocol, you can start the discussion about that strategy and summary, what is next. And then you can tell the patient, okay, this is an early, we have good news for you as well, that it is an early stage. The good news for you, sorry, you don't have to tell the patient that, okay, this is good news that it has been that you have got this cancer. No, do not say that this is a good news that you have got this type of cancer. Say that we have good news in terms of the treatment options, that this has been caught in an early stage and we have various treatment options available for it. And there are very good chances, or there are very high chances of complete recovery. Okay, for treatment. There are very good treatments available for it. This is the good news. This is not the good news that, okay, you have, this is a good news that you have been diagnosed with in situ carcinoma. You have diagnosed with carcinoma of breast at an early stage. No, you have to tell that we have good news in terms of the treatment for you, that this particular type of tumor can be treated. And then the patient might ask you some questions. Are you sure I have a cancer? Unfortunately, Mrs. Taylor, the biopsy reports have confirmed it, that you have got cancer. And the patient might say, okay, how come I didn't feel any lump? So you would say, well, the report says it is an early stage of cancer, and this particular type of cancer is called carcinoma in situ. So you may not be able to feel any lump until late. Okay, and not all cancers present with lump. And then explain the treatment options. What are the treatment options? About the treatment for the breast cancer could be either surgery or radiation therapy, which is radiation therapy, giving some radiation to the breast tissue, or chemotherapy, that is taking medications. That is a medical treatment. Okay, surgery would involve either removing part of the breast, which is called wide local excision, or removing the whole breast. And the patient might say, yes, I've heard of it. It is quite embarrassing. And then you have to tell them about cosmetic surgery as well. Okay, cosmetic surgery, we have a lot of advancements in surgical fields, that we have got cosmetic surgery, and getting an implant could be an option for you if this is that you are worried about. The plastic surgeons and the breast surgeons may help you with reconstruction after you have completed your cancer treatment. In this day and age, they have very good treatment options for the breast cancer. There is a possibility that it can be cured. Okay, so you have to tell everything about this. And the next is HIV test results. So the same, it's the same. Okay, let me tell you that this particular type of scenario, you don't have to ask that would you like someone to be present with you for discussion, or are you here on your own? Okay, this is a private thing. This is a private, the patient has tested positive for HIV. So in our society, it's not like in society which we live, they do not look good over patients who test positive for HIV. So this is a dilemma. It's an emblem over them that, okay, they have tested positive for HIV. So you do not have to ask. It's a private thing. You have to maintain their privacy, because they have come to you, they have been they have been diagnosed with HIV. So you do not have to breach their confidentiality. Okay, so you do not ask for any support, or anybody should be present by your side to discuss the results. Okay, and you will be discussing the results the same way as I discussed it. But here what you have to do is you have to take the history before going into the details before discussing the test results, you have to take complete history, because you will be knowing particularly the sexual history, travel history, sexual history, occupational history. All those histories are very important in this scenario, particularly the sexual history, because the diagnosis, you have to trace the context as well. Okay, because you will be convincing the patient, counseling the patient regarding telling their partners, regarding telling their ex relationships. Okay, so you have to take history from the patient over in this scenario. And you have to tell, okay, I would be discussing, I have got the test results with me, I will be discussing the test results with you shortly, but before that I need to ask you a few questions to have a better understanding about your condition. So then start taking out history, start digging it. Okay, and what you have to do is, because based on this, you will be answering the questions of the patient, because the patient will be asking you, can you please tell me the results? Are you sure I have HIV? Can you please repeat the results? What does this mean for me now? Should I inform my employers? What is it? How is it going to affect my life? Should I get my wife tested? How did I get this HIV infection? Okay, so if you have taken the history, you would be knowing that how did the patient get this HIV infection from. Okay, and then you have to explain how you have to explain the result. You have to tell, you do not have to tell that, okay, I have the result, I have the test results with me, and all blood investigations and the tests are fine, but there is a test results, or there are some test results that show that you have got HIV infection. Do not say that you have tested positive for HIV. The patient might not understand the meaning of positive. What is the meaning of positive for HIV? No, it means just tell the patient clearly that, okay, you did some tests last week or whenever they did those tests. So your HIV test results, the test results or the report of the results show that you have got HIV infection. Okay, so he will ask, what is HIV? Then you have to explain that HIV stands for human immunodeficiency virus. It is a virus that damages the cells in the immune system and weakens the ability of the body to fight everyday infections. Okay, and then he might ask any question about AIDS. So then you can explain about AIDS, or AIDS stands for acquired immunodeficiency syndrome. This is the name that is used to describe a state of very low immune system, and the body becomes susceptible to the threatening infections and diseases. Okay, it is AIDS and HIV. Both HIV and AIDS are different terminologies and two different situations, two different conditions. Okay, AIDS stems from HIV. Okay, which is more severe form of very low, when body's immune system has been destroyed. Okay, so we call that condition as AIDS. HIV is virus present in the body, which is human immunodeficiency virus. Okay, and you can reassure the patient that, however, with treatment, people with HIV can live long without having AIDS. Okay, you do not have AIDS at the moment. You have HIV infection that may cause AIDS, but there are treatment that can be offered. There are treatment options available that can be offered to treat this particular type of infection. Then the patient will ask, okay, how did I get this infection? How did I get the HIV? Then HIV, you will be telling HIV is a sexually transmitted infection. It can be transmitted through vaginal, anal, and oral sex. It is also a blood-borne infection, which means it can be transmitted through blood transfusion, instruments used in operations, or making tattoos. And then once you have taken the history, if there is something in the history, sexual history, or there might be some partners, or there might be some relations in the past, so you can trace them, and you can tell that that might be the cause that you have got this infection. Or patient might have said that, okay, I've got tattoos over here, or surgery done, unsterilized instruments, or he had sexual relationship with a prostitute, okay, with a homosexual, and then while he was on a trip to Thailand or whatever, and then you can assume, you can tell that, okay, you might have got this infection from there, from that relationship, okay. And then he will be asking, okay, are you sure I have HIV? You have to tell, okay, unfortunately, the test reports confirm, the results confirm that you have got HIV infection. Can you please repeat the results? Yes, Mr. Smith, we can repeat the results, but we double check the types of results, and these results have already been confirmed. Okay. And can you please, what does this mean for me now? And should my wife be, how it's going to affect my wife, and should my wife be tested? Okay. So what does it mean for the patient now that he has tested positive for HIV? So he has to inform his wife, he has to take precautions, he has to bring his wife for testing as well, and inform his ex-partners as well. Okay. And he needs to inform anybody in future he's going to have any sexual relationship with any person in future, he needs to inform them of his HIV status. Okay. This is all that does mean for the patient at the moment. And the patient is asking, okay, should my wife be tested? So it is recommended you should inform your wife. You should, is it possible for you? It is something that we recommend, that your wife should uh, come and she should be tested for HIV infection. Okay. Should I inform my employers? So you do not have to, you should tell that the patient does not have to inform his employer unless he has a contract with the employer or his job demands it. For example, he is a nurse, or he's a doctor, or he is nurse or doctor. Okay. So these sort of jobs, or he has some contract with the employer that he has to declare his health status. So and also medical, if he has got some insurance, he has to disclose it to the insurance companies as well, otherwise his insurance will be void. Okay. And mm, uh, how the patient will say that, how is it going to affect my life? So I have already told you that the patient has to inform the medical insurance company, and if they found it at later stages, his insurance become void. And also the thing is that getting a medical insurance may become difficult for him in future. Okay. And also you have to reassure the patient that everything that has been discussed will be confidential, and we won't inform anyone of his test results. We won't discuss it with either with his wife, but before that we will, before telling his wife, if we are to tell, but before that we convince the patient to tell his wife about his HIV status and bring her for testing. And if he fails, then we can inform through partner notification program. Okay. And offer support and give leaflets and everything, and contact doctor, you can refer the patient, you can ask, arrange follow-ups and all those things. Okay. This is a long scenario, you need to be quick. And can we still have children with HIV? Yes. The answer to this question is yes. You can still have children with HIV as long as you are taking the treatment. When the cell levels in your, there is a type of cell in the body called CD4. When it reaches to reaches above or reaches to a certain level, we will allow you to have unprotected sexual intercourse with your partner, and you can have children. Okay. This is the answer to all his questions. So I think this covers breaking the bad news approach, and that has been covered in detail. So anything you would like to ask so far? Anybody would like to ask anything so far? Okay, so now we are going to start with the medical errors. We have another approach called Cohn's protocol. We have to follow this approach. It is again an acronym, which is C is for context. Okay, prepare what you context means like prepare what you are going to say, your body language, your mentality, anticipate a reaction. The patient might be angry, might be frustrated, might be disappointed, or they might be a bit aggressive. Okay, or things might heat up when you discuss this error, disclose this error to the patient. Okay, so you have to normal, it will begin like a normal discussion, and in between the things when you disclose that error to the patient, though things may escalate at that time. Okay, the patient might get frustrated, angry, or upset. And then you have to do grips, paraphrase the scenario. Can we go through what happened last time when you came to the hospital? For example, I've been asked to come and talk to you about your treatment. Can we go through what happened the last time you came to the hospital? When did you come to the hospital? What symptoms? Ask 4 questions. 4 questions are must. Why did you visit the hospital? When did you visit the hospital last time? What symptoms did you have? What investigations did they do? What treatment did they give you? Okay, ask these 4 questions. And how are you doing so far? It's the last question. What happened after the treatment means how are you doing now? So then you go to opening shot to alert the patient of the important information that, okay, I have got some important, Mr. Matthews, I have got some important information regarding your treatment that you have to know. So then the patient might be, they might be startled, or they might be get anxious. Okay, so what is it? Go on, tell me. Then you will tell, okay, as you mentioned that you came to the hospital with shortness of breath a few days ago, and then they perform investigation and they told you that you had got MI, or you have got pneumonia, and they offered you this treatment. They gave you antibiotics, and they did some chest x-rays, and then they give you antibiotics and they sent you home. You were basically, you were treated, or you were diagnosed with pneumonia. Unfortunately, there has been a mistake in the way we have managed you, or there has been a mistake in the management. Okay, you have been treated based on the wrong x-ray, and your x-ray were actually fine, or you didn't need the antibiotic that you were given, or you were told that you were fine to go home. Unfortunately, that was a mistake. And for example, the ECG showed abnormalities or anything the scenario is giving. Okay, and then go to emotions. Again, the same Eve protocol. I can see that you are very disappointed with what has happened. It is disappointing, and we are very disappointed as well. And I'm sorry for what has happened. And common concerns are, the patient might ask you that, okay, whose mistake is it? Can you tell me who was the doctor? What are you going to do for me to make sure this doesn't happen again? How often does this happen in this hospital or GP surgery? Why did this happen? Answer for all these questions is to offer apology first and foremost. And then you have to tell the strategy. You can answer those questions. Okay. So whose mistake was it? I'm sorry. I do apologize for what has happened. It should not have happened. At the moment, I do not know whose fault is it. It could be a mistake of an individual, or it could be due to failure of the system that we have in place. We will be investigating this issue and get back to you, and emphasize that we will investigate what has happened, and we will get back to you, and we will be open and honest with our investigations. Okay, how often does this happen? Unfortunately, I do not have that information right now, but I will find out and let you know. I will find out and get back to you. How did it happen? At the moment, we don't know how it happened, but we will investigate and get back to you. We will be honest and open with what has happened. Okay, you have to give these questions. You just have to, this is a sort of scenario where you have to apologize. You have to say sorry, because mistake has been done on our part. So we have to apologize and do it for real. What are you going to do to make sure that this doesn't happen again? We will be investigating how and why this happened. The hospital takes these type of incidents very seriously. We will hold what we call as significant event analysis meetings. Okay, remember this word, or you can simply say root cause meeting. Root cause meeting or significant event analysis meeting to find out what went wrong and where it went wrong. This is a priority, and I will fill an incident report form now to make sure everyone is aware of this. And also we will review the guidelines and protocols that we have in place, and we will make necessary changes to these protocols and guidelines to prevent this from happening again in future. And then involve seniors. Involve your seniors in all the scenarios, okay? Whenever you get stuck or you don't have answer to any question, just say that I'll just go and confirm it with my senior. I'll just go and consult it or consult. I will ask my consultant and get back to you with the answers. Okay. Involve senior. I will tell the consultant about what happened as well, and they will come back and talk to you. If the patient is really angry and you fail to calm that patient down, then you have to offer the consultant. You will tell, okay, if the patient insists that I want to see your consultant, then you have to tell, okay, I will arrange a meeting with the consultant, or I will ask my consultant to talk to you. And then then what you need to do is you have to refer the patient to PAL's office. It is Patient Advisory Liaison Services. This is a complaint department. You can inform the PALs about your experience. Okay, complaint department in the hospitals and in the GP surgery, you refer or you make refer the patient or complaint to practice manager. Okay, GP manager. Follow up, we will investigate, and once we get to the bottom of this, we will contact you, make a report, and we will explain what has happened, and we will be open and honest. Okay, and then you can ask that, okay, how would you like to be informed of what has happened? Would you like us to make a call, inform you through email, or would you like us to book another appointment for you? Okay, or would you like to come in person? Okay, then you can ask all those things. Then let's discuss scenario. Okay, you are working as FI2 in coronary care unit. Your next patient is Peter Branson, a 55 years old man who was admitted to the hospital with myocardial infarction 2 weeks ago and was diagnosed with myocardial infarction. 3 days prior to this admission, that is 2 weeks ago, and more 3 days prior to this admission, he had come to the emergency department with chest pain. He was seen by one of the emergency doctors who performed an ECG, which was reported as normal. The blood tests were done, but patient was discharged home on the basis of normal ECG before the troponin levels were checked or the results were out. He was discharged home with a diagnosis of musculoskeletal pain. The cardiologist has reviewed the ECG and blood tests which were performed in the emergency department. ECG shows T wave inversions and the troponin is also positive. Explain the medical error to the patient, assess for any complications, address his concerns, and discuss further management. So we have to explain the error that this has happened. Now the patient has come to you. Patient is doing quite fine. He has already been treated. Okay, but you have to explain the error that has happened before this admission, because of which the patient was sent home, because of which the treatment was delayed. So the patient has got some question as well, that why did your colleague miss it? What are you going to do for me now? What does T wave inversion mean? Can I see the consultant about this problem? Why did this happen? Could this have been prevented? Does this happen frequently with other patients? Okay, so your approach will be same. You have to ask about the current visit, go do your grips, and after that introduce yourself and do everything, and then ask about the current visit. Ask about, okay, how are you feeling now? Check for any complications on this current visit, any complications of heart failure or any complications of MI, for example, any pulmonary edema, any Dressler syndrome, or any chest pain now, any other symptoms such as shortness of breath, any heart racing, any swelling in the leg, any fever, all those complications. Okay. And then ask about the previous history. I understand that you came to the emergency department 3 days prior to this admission. And can you tell me what complaints did you have? What symptoms did you have? What investigation did they do? What diagnosis they made, or what did they tell you, and what treatment did they give you? Okay, those 4 questions. And after that, you have to tell that Mr. Peter or Mr. Branson, unfortunately, I have Mr. Peter, I have an important information regarding your treatment that you need to know. So then narrate, tell that, okay, unfortunately, there has been a mistake. You mentioned that you were here a week ago, 2 weeks ago, or 3 weeks ago, 2 weeks ago, and you presented to us with chest pain, and at that time a chest X-ray was done, or ECG was done, and you were told that it is normal, and you were sent home with a diagnosis of muscle pain, or pain arising from your muscle and chest wall, and you were sent home on medication. But actually, your ECG was not normal, and blood levels revealed there was abnormality, or your troponin levels were high. Okay, and there was some changes in the ECG as well. So you have to tell the patient. So the patient might get angry or frustrated, or patient might react, things might escalate, and then you have to tell the error that this has happened. And then actually the test revealed that unfortunately you had a heart attack. There were some findings in line with a heart attack in the ECG and the blood test as well. And then patient might get angry, upset. You have to use Eve protocol. I can see that you are disappointed, you are upset, and it is disappointing. We are disappointed as well. I'm sorry for what has happened. And what is next? Then you have to wait for the patient to respond, if he is shouting or he is yelling or whatever, because the patient literally they sometimes shout. They say, okay, so who's responsible for it? It's something you are going to tell me now. I had a heart attack. You are so careless, and the patient may scold you, and then he may get very angry. And okay, this has been done, and how are you treating patients over here? I came here for treatment, and you are telling me that this was not my diagnosis, and this is my diagnosis. So he might get upset. So you have to use Eve protocol. Just keep silent. Just say sorry. Just apologize. Okay, with head nodding, and just say, I'm sorry. If you do not, because you do not have to answer all the questions, and we need to run. And then what's next for the patient? So you need to ask that, okay, we need to run some tests and ensure you didn't develop any complications because of your heart attack. Tests like ECG, blood test, echo, this will be reported as what are you going to do? What's next? And then this will be reported as significant event. You can make complaint to the PALS office as well. And we will be filling an incident. I'll be filling an incident report form, so that everybody knows about this incident, that this has happened, so that it should be prevented in the future, and we can make changes to our guidelines. You can tell those things, and you can offer PALS for feedback and complaint if the patient wants to lodge a complaint, and you can arrange meeting consultant as well. Okay. And the patient might ask you that, okay, why did your colleague miss it? So you can tell that they did an ECG. I'm not really sure about it, but they did an ECG and a blood test. They sent you home on ECG finding. ECG had some changes in line with heart failure, a heart attack, but they didn't identify them. In addition to this, that day you were sent home before checking the blood test, and the blood tests were not here at that time when this diagnosis was made. Okay. So if the patient is not, you cannot calm down the patient, or then you can offer senior. Okay, you can say, okay, I can ask my senior to come and have a chat with you. You can talk to my consultant. I will ask my consultant if the things escalate. And then, could this have been prevented? So you can tell this could not, unfortunately, this could not have been prevented because when you came to the hospital, you already had a heart attack. So the diagnosis was delayed. Yes, but the condition had already happened. And how does this happen frequently with other patients? This is not something very common, or it does not happen very frequently, but it is very unfortunate situation that this has happened to you. Okay. And can I see the consultant about this problem? You can say that, okay, I can arrange a meeting with the consultant. Uh, and what does T-wave inversion mean? You can tell the patient on the ECG that, okay, you have got here, we have got heart tracing, and this is a T-wave which shows if there are some changes. Changes in T-wave means that there is some sort of abnormality with the heart. So which is most likely the heart attack. Okay, in your case. So you have to do that. All right. So this is all about this missed MI scenario. Okay. I would like to take a break for 5 minutes, just for 5 minutes here, and then we can discuss the rest of the scenarios. Is it okay? Okay, the next scenario is a child with rash. You're identified to in pediatrics unit. Elisa Adams is a 30-year-old lady who had brought her 4-year-old child, Ella Adams, to the emergency department with chest infection. Child was prescribed amoxicillin and discharged home. After taking amoxicillin, the child developed rash and developed all over his body. The mother has come back to hospital, talked to her mom, and addressed her concerns. Okay, so you should expect that the mother is quite angry, and she is uh, asking, she the moment she enters the room, or she is there, she asks for the doctor. Okay, where is the doctor who prescribed amoxicillin to my child? Okay. And then you have to, what you have to do over here is you will be starting with type 2 approach, that whenever somebody jumps to you, before you start talking or you introduce yourself, what you will be doing, you will be asking, okay, I beg your pardon, can I confirm a few things before we discuss about your child's condition? And then ask about, introduce yourself, ask about the previous current situation, what happened, incident, take the incident history, current situation, and then ask about the previous visit, what happened, and everything. Okay, you have to ask about that, and then you can start answering, you're addressing the concerns. But before that, you need to take history, proper history. In this scenario, you have to take allergy history, medications history, and any previous such reactions with amoxicillin, how he was diagnosed. You have to take the history, and then what you have to do is you have to apologize, because there has been an error. Amoxicillin was prescribed, and you have to apologize for this. Okay. So we will just be quickly going through, you know the format, that how to complete it, how to take the everything, how to take the history. Then we will be just quickly going through the questions of the mother, that she is saying. You have to, at this time, you have to examine the patient as well. Okay, you will be taking history, examine the rash, and tell that, okay, the rash look like an allergic one. And after you have examined, and I will ask my consultant to have a look at this rash as well, and we will be giving some medications for the rash to settle. And we will, what we will do is we will put a chart, or we will document in his notes about the allergies. Okay. uh, uh, will the rash clear if you change antibiotics? Okay, you can tell that, okay, yes, the rash will clear with changing the antibiotics. Will the chest infection be cleared as well if the change? Yes, you can say yes to this answer as well. Okay, what are the long-term complications of giving my child amoxicillin? You can say that there are, as it is, a rash can happen like this happened this time, but there are very little chances of any long-term complications, but provided that we need to avoid amoxicillin. Okay. And what are you going to do now? what we are going to do now is we are going to document it in the allergy sections. We can put some allergy cards or some bracelets mentioning that the child is allergic to this medication, so that the staff and the doctors know about the allergy status of the patient. And again, we are going to do what we are going to do. We will be filling incident report form, PAL's office, and all those things, and you can do those things. You will have to follow Cohn's protocol. Okay. Where is the doctor? You can ask, okay, I think that you might be talking about, or you are talking about my colleague. He's not here at the moment, but once he comes or he's here, I will ask him to meet you, or I will inform him of your arrival. Okay. And what are you going to do to prevent this from happening? I have already answered this question, that you will be mentioning the allergies. Okay, that okay, the child is allergic to this medication, particular medication, and this should be avoided in future. The same scenario is pretty much similar, that FI2 in peds, antibiotic error in a child. That patient is 4 years old child who was brought by her mother to the emergency department with chest infection. She has been prescribed IV augmentin, that is coamoxiclav. While the nurse was trying to give the antibiotic, the mother stops him and tells him that nurse that already informed by her that the child is allergic to antibiotic. The antibiotic was changed to a different one and the child is responding well. Mother is upset that the child was about to be given an augmentin. Talk to the mother, address her concern. So here the child has not been given antibiotic. The mother has already stopped. So you have to follow the Cohn's protocol. And what you have to do over here additional is you have to acknowledge and you have to appreciate mother's action, that okay, Mrs. Smith or whatever her name is, what you have done is a great job, and you have stopped a very big mistake from happening. And if this would have happened, so the consequences would be grave. So I appreciate that you were present there and you did this. Okay, you stopped the nurse from giving this, but she will be upset and you have to go with that Cohn's protocol. Okay. So the key point is that you have to acknowledge the mother's action in this scenario. And you will be taking the history that, okay, you have to take a bit of history that, okay, did you inform the nurse, who was the nurse in charge, who else have been informed about the allergy status of the child? Did they already know that he was allergic? Your child was allergic to augmentin. Okay. And did you stop just before giving, or was the medicine given how was the nurse injecting the medicine halfway through and you stopped it? You have to ask. Okay, you have to take these histories, all that history, and then if she says how often does this happen in the hospital, you have to say that okay, it is something that usually does not happen in the hospital, but I'm sorry that this has happened. This is an unfortunate situation that this has happened. Okay. Will the doctor at least get in trouble for doing this? You will tell that, okay, we will conduct a significant event analysis meeting or root cause meetings, and we will get to the bottom of this issue. And once we have conducted the investigation, we will get back to you and we will be open and honest. Okay. Again, another patient, antibiotics to the wrong patient. FY2 in the medical outpatient department. Patient is 50 years old who has come for follow-up 6 weeks ago. He presented with cough, had an X-ray done, treated with amoxicillin for pneumonia. This was based on chest X-ray findings. He was discharged after 2 days. However, when the department got the radiology report, his X-ray was reported as normal. It was found that he was treated based on another patient's X-ray. Talk to the patient, explain the error and address his concerns. Okay, it's similar to the MI scenario. Okay, and we will be just going through. You have to follow the Cohn's protocol. You will be telling that okay, at the time you came, you were having this problem, and this was your diagnosis was made, this investigation diagnosis, and you were treated based on the X-ray of another patient, and which has been a mistake on our part. And so we are really sorry you're disappointed and everything. You have to go with that Cohn's protocol, and after that you have to address his concern. Okay, don't you label the X-rays. You have to tell that okay, we routinely label the X-rays, and sometimes due to the similarity of the names, X-ray, this has happened in your case, the X-rays mix up and they get confused. So this is something that happened in your case. So we are sorry for that. What happened to the other patient? So you can say that, okay, as soon as we recognized, as soon as we came to know that this has happened, we contacted that patient, or somebody might have contacted that patient, and this patient has been informed that this error has occurred, and we have been open and honest, or we would be open and honest to that patient as well. And we would make sure that nobody has suffered. Okay, and he might have got the appropriate treatment. Will I develop long-term complication as a result of this? So you can tell no, it is highly unlikely that you develop any complications. Apart from that, if you develop diarrhea or any ringing in ears or anything like that. So apart from that, no long-term complications. Apart from it, that there is a problem that if antibiotic resistance can be developed, but it can develop after using antibiotics for quite longer period of times. So it is highly unlikely in your case as well. Okay. I had a diarrhea and tummy pain after using antibiotics. You can say apology. You can offer apology for this. This could be the side effect of antibiotics, and we are sorry for this. If not pneumonia, then what was my diagnosis? You have to tell that, okay, your diagnosis was simple flu, for which you did not need any antibiotics, right? And lost renal biopsy. This is a patient. PRFY2 in renal medicine. Patient is 18 years old who was admitted with suspected glomerulonephritis. He had a renal biopsy taken 2 days ago. He has been waiting for the results. When the department talked to the lab said that they did not receive the biopsy. A thorough search was conducted to find out the biopsy, but it was not found. Talk to the patient, explain what has happened, and address his concerns. Okay, so it might be over the phone, or it could be face to face, but you have to talk to the patient. You have to inform him, and you have to inform him of his results, because the patient will be there. He will be telling, okay, doctor, could you please tell me about the results? And you will be starting with the Cohn's protocol, and you will be telling, okay, of course, I'm here to discuss the results with you. I will be discussing the results with, I am here to talk about your biopsy. Okay, do not say I will be discussing the results. Say, I am here to talk about your biopsy or discuss about your biopsy. So then you will be telling that, okay, unfortunately, there has been some problem with your biopsy. The thing is that when we took your biopsy, we sent it to the lab, and for a couple of days, we couldn't hear from the lab. And when this morning or this evening, we contacted lab, we received an unfortunate news that your biopsy, they could not find your biopsy, or they have misplaced your biopsy. Okay, or they have lost the biopsy. You can say all those things, and the patient might get frustrated, angry, and whatever. You have to use that Eve protocol, and then offer pals and everything. And then you have to, what's next for the patient? What you have to do is you have to convince the patient for retaking the biopsy, and he will say, no, it is painful procedure, I don't want to go for biopsy again. But you have to tell the patient that your condition, biopsy was done. It is important because we wanted to know about your type of glomerulonephritis, because treatment is different for different types of glomerulonephritis. So we have to take this biopsy again, and we will be doing it. We will be making sure that that your experience should not be as you felt last time. We will try to minimize your pain. We will be giving some painkillers and doing it under local anesthesia, that is numbing the place. Okay, and also we'll be giving you painkillers, and we will be trying to be as quick as possible, and we will be taking great care of your sample. This time I myself will label it and take it back to the lab. Okay, you can do all these, you can say all these things to the patient to convince the patient. Ultimately you have to convince the patient for a rebiopsy, because that's in the best interest of the patient. Rest would be the same. Missed fracture in a child. It's the same. It's a telephonic conversation, maybe. You are referred to an emergency department. George Jones is a 7-year-old child who was brought to the hospital by his father 2 days ago with pain in his right arm following a fall at home. When he was brought to the hospital, he had an X-ray done, which was reported as normal. Today, the radiologist has reviewed the X-ray and found that there is a hairline fracture of the radius. The father has just been called to bring the child to the hospital, and he has now brought the child. Okay, the father has been called, and the child is already in the hospital. So what you have to do is, your consultant had reviewed the X-ray. He agrees with the radiologist about the hairline fracture. The orthopedic consultant has advised you to place a plaster cast and arrange follow-up in 2 weeks' time. Explain the medical error, discuss management with the father, and address the concerns. Okay, it's the same apology and everything. You have to discuss and you have to answer this question. How was the fracture missed? You have to tell that, okay, we have this particular type. This is a very you can say minute or tiny fracture. It is a hairline, very thin fracture, which is not easily detectable. So that's why we have to send our X-rays. Once we see those X-rays in emergency department, these are sent to be reviewed by the X-ray specialist. Okay, and if there is any change, they inform us of this change, and this is very often very difficult to detect. This type of fracture is very difficult to detect by a junior doctor. Okay, so that's why the specialist has reviewed the X-rays, and he has told us that your child has this type of fracture. Okay, what are you going to do for him? So what needs to be done is, this is a very you can say thin fracture. So this heals spontaneously. This heals in itself in children because blood supply is quite fine. And for that, we are going to apply a cast which will remain in place for 2 weeks, and we will be following up in 2 weeks time. Okay, can I talk to the consultant? You can offer the consultant. Okay, yes, I can arrange a meeting with the consultant. Okay, how will you make sure that this does not happen to another person? So I will fill an incident report form. We can refer you to the PAL's office as well, and we can what we can do is we will be arranging root cause meeting and all those things. Okay, doctor, 2 days have passed since the fracture. Will this affect the outcome of the fracture? It is highly unlikely that it is going to affect the outcome of the fracture. Okay, this should be your answer. Okay, the next approach. So far we have discussed all those things regarding angry patient and breaking the bad news. Breaking the bad news and missed medical errors. Okay, or missed errors or medical errors. So now we are going to discuss about angry patients. We are slowly and gradually progressing towards transition from low, you can say, the mood consultations to heightened and escalated consultations. Okay. So do you people have any questions so far? So we can begin with the next. If you do not have any questions, we can begin with the next approach. Any questions so far? So as I mentioned before that as long as you have approach in mind, you can cover any scenario, you can crack any scenario. Okay, so it would be very easy for you to tackle that scenario. So angry patient approach, we follow Buster protocol. Buster stands for, it's again an acronym. So B stands for be prepared. Okay, expect emotions, have your own emotions and the emotions coming from the patient's side or the relative side. Okay, have a plan for how you will do it, especially if you have to give bad news. It has already been mentioned. I already mentioned it in BBN. And monitor what you think and feel. Okay, practice self-regulation. Keep your own emotions in check when your buttons are pushed. Aim to turn the confrontation into a conversation. Know when not to have conversation. Okay, when emotions are too intense and things have escalated, so you need to keep quiet and you just have to say sorry. Do not respond, do not reply, or do not try to argue. Okay, and you have to use non-judgmental listening. Remember, it's not about you, but about the others' disappointments, fears, anxiety, etc., which often underlie the anger, blame, or denial on the surface. Maintain eye contact, listen without interrupting, only making clarifying statement and paraphrasing. So let me see if I understand. What I hear you saying is put your own agenda aside until the other person is finished. Avoid trying to make a situation better when it is grave. I'm sure things will not be as bad as you think. 6 seconds rule to avoid escalation of conversation. Okay, be quiet or take a pause for 6 seconds when your own emotions start to boil, especially in response to anger or blame. Wait at least 6 seconds or more if needed for them to calm down. Avoid being defensive or blaming. Well, it didn't work because you wanted too long to get help or you waited too long to get help. Gather your thoughts and use skills such as tell me more or empathetic validating responses. Tell me more, and T stands for tell me more. Invite the person to expand on what they are saying. Tell me more about your husband. What happened after that? What other concerns do you have? And then empathizing and validating to acknowledge and diminish emotions. Acknowledge emotions by emphasizing, I can see you weren't expecting this. This isn't easy to talk about, is it? It's very stressful, isn't it? It must be hard to come here every week. I can see how difficult it is for you. And respond with a wish statement. Let the other person know you hear them and acknowledge that the goal may be desirable. But I wish I had better news. I wish I didn't have that to tell you this. I wish we had a more effective treatment. I wish things had worked out better. Okay, this is a Buster protocol. You have to follow that. But I have simplified it for you. Here it is more simplified. You have just keep in mind these things. Okay, there's a more simplified version. Just keep those things in mind and do the grips. Take history, what happened, when happened, what's the main concern, what is the most important thing for the patient at the moment, and in terms of going forward, what would the patient like you to do for them. Okay, and acknowledge any emotion with ease, and then reassure. We will look into these matters and we will find out what went wrong. If there's a colleague, so we will talk to him, and if there is something uh, there's some problem with the system, we can bring changes in the protocols and guidelines, and we can modify our system as well. Okay, and reassure and follow up. And if unhappy, really unhappy, and patient wants to complain, then you can offer PALS, okay, or practice manager in GP, and then discuss and give feedback, and then summarize. If the patient has any questions at the end, you can ask. Okay, so there are two types of events: significant events and non-significant events. Significant event means then where you need to offer PALS. Okay, PALS office, you have to refer to the PALS, and it is a genuine reason that they are getting angry. But there are certain events where they are the patient's life or patient's health has not been at the stake. So these are non-significant events. So there is no immediate threat or damage to patient's life. So it's not significant event. So significant events are misplaced renal biopsy, post cyst removal infection, baby covered in poo or vomit, heart failure. Talk to the son. It's a son who's calling again and again to ask about her mother, but some of the staff picks up the phone, and then they just do not give any information and then keep the phone down. So this is a significant event that should be complained of. Okay, and missed foreign body in the esophagus, missed hairline fracture, missed foreign body in the lungs, missed hip fracture, missed MI. These are the significant events where you can offer PALS office. Okay, and management would be the same, that for the event you have to make incident report, and then you for the feedback you refer to PALS office, and for the then even a significant event analysis meeting or root cause meeting here as well. And fourth, you don't have answers to all their questions. So do not try to answer all questions. And fifth, lesson is learned and we will make changes, protocols and guidelines. It's pretty much similar to medical errors, but in this case, the patient will be more aggressive. His or her emotions will be more intense. Okay. So you have to keep those things in mind. And non-significant events are post-MI physiotherapy, delayed IV cannula, hypothyroidism medication change, and mislabeled blood test. Okay, these are non-significant, so you do not have to offer PALS office or we do not arrange, we do not hold any significant event analysis meeting. Okay. And if the patient is really angry and they insist on complaining, then you can offer PALS office. Okay, let's start with post-op wound infection. So there's a patient, URFI2 in surgical unit. Elizabeth Wilkinson is a 30-year-old lady who has been readmitted with a post-operative wound infection. She had a cyst removal 3 weeks ago on her left leg. She was discharged home, but 3 days ago, she was admitted with wound infection. She has been treated with IV antibiotics and she's now fine. Patient is not happy that she has developed the infection. Please talk to the patient and address concerns. You do not have the patient's previous notes. So she has come to you for the first time. You are the doctor seeing this patient first time, and she has been to the practice before or to the hospital before, unit before, but you are seeing the patient for the first time and you do not know the previous notes or previous history. So what you need to do is you have to start the introduction. Maybe if she is too angry or aggressive, then you have to calm the patient down, and then you have to follow that buster protocol or ask about do the grips or type 2 introduction, start type 2 introduction. Okay, pardon, can I ask your details and can I check your full name and date of birth? Okay, by the way, my name is Dr. Rahman and I'm one of the doctors in surgical units. Okay, can you please tell me what happened? Could you please tell me what happened so that we are on the same line or we are on the same page to have a better understanding about your condition? What happened? You underwent, and I understand that you had a surgery done. How are you doing now? You can ask, okay, to calm her down, and then she will narrate, she will tell, okay, I had this surgery and this is infection and this. You will be saying, okay, I'm sorry that this happened. Then you will be asking about the dressing. Did they tell you about this complication? Did they tell you how to change the dressing? Have you been changing the dressing regularly? Or did they tell you about the complication? The patient would say no, and you will tell, you will ask them, okay, did you ask about the complications? Okay. And then what symptoms do you have at the moment? Ask about fever, any pain, any discharge, what color, any oozing, everything. Okay. And how frequently? Ask about any medical condition, for example, blood pressure, high blood sugar, any smoking history is very important because it also delays wound healing. Diabetes delays wound healing, or any medications, for example, steroids, they reduce body's immunity, as well as also this healing process as well. So they affect it. Okay. So you just have to apologize. You have to wait, and you have to calm the patient down. Okay. And then you have to answer the questions. Why was I not prescribed antibiotics after surgery? You have to tell that since it was a clean surgery, so we do not usually provide or prescribe antibiotics after the surgery. But a consultant knew, or it was advised by the consultant that you do not need any antibiotics after the surgery. Normally, in routine process, we do not prescribe any antibiotics after this type of surgery. Okay. So I'm sorry that this has happened in your case. And does this happen frequently in hospital? You can tell, I'm not really sure about it. It is something that does not happen really, but I will go and get back to you with the information. Why it is that no one explained how to change the dressing? You have to apologize here. I'm sorry that nobody told you that how to change the dressings. So you can apologize over here. Okay. I'm really sorry that nobody has apologized. We will look into this matter. We will see whose fault is this, and then you can offer PALs and all that things. We will hold significant event analysis meeting. You can give your feedback. You can refer to the PALs and all those things. Okay. And after that, we have another scenario with a blocked cannula. You are working as a foundation year 2 doctor in the acute medical unit. Your next patient is Sarah Rivers, a 39-year-old lady who was admitted yesterday following an insect bite on his arm, on her arm. She has been receiving antibiotics for the past 24 hours. The consultant has reviewed her this morning and has decided that patient should receive 1 dose of IV antibiotic today at 10 a.m. and then can go home. One of the nurses went to administer antibiotics at 10 a.m., but the IV cannula got blocked and she could not administer the antibiotics. One of the foundation year doctors, Dr. Wilson, had seen the patient 2 hours ago and promised to come back and insert a new cannula, but it has been 2 hours now and she has not returned to see the patient. Patient is upset about the situation, wants to lodge a complaint. Please talk to Sarah Rivers and address her concerns. Okay, why did your colleague not come back? Can you just tell me what happened? And if the doctor offer you to go and find other doctors so that it can come, you reply, I do not want to see the female doctor again. What are you going to do now? Are you going to talk to your colleague to attend to me or colleague or attend to me? Okay, can you give me oral antibiotics and I can go home? Okay. So here it is that the cannula has been blocked and it has not been changed. One of the doctors came and she said that I will be changing the cannula, but she couldn't come due to some reasons. It could be any reason. She might have been stuck anywhere in any emergency. Okay. What you need to do is you have to talk to the patient. The patient is very angry because she wants to lodge a complaint. So you have to ask about it. Okay. You have to tell the patient, you have to acknowledge that, okay, and that importance that, okay, I understand that to me, your antibiotics, your medication is a priority. It should have been given at its time, and you should take the history, what happened, who was the doctor. You should take all that history for apology, and then you will see why did your colleague not come back. You will tell that, okay, I will go personally check it and we will investigate what happened and we will be open and honest to you. Can you just tell me what happened? You will tell that actually I'm not sure, I do not know at the moment, but I will go and get back to you with the information that what happened. Okay. And if the patient says that I do not want to see that female doctor, then you will tell, okay, we are not going to ask that. We are not. We will ask our colleague to come and apologize to you. But if she says I don't want that doctor to treat me, and then you will say, okay, it is your choice. We will not ask that doctor to be a part of your treatment. Okay. So the next is, what are you going to do now? Are you going to talk to your colleague or attend to me? So you will be saying that no, we will be talking to, I'll be going and talking to the colleague as well, but later. But before that, your medication is our priority. So is it okay if I change the cannula myself and insert a new one? Would that be something you want at the moment? Okay, you have to tell that, okay, I'm going to do it myself. So would you allow me to do it? Would that sort out the problem? Is it something that will help? You have to do that. Okay, this is the main thing you have to. And can you give me oral antibiotics and I can go home? You have to tell that, okay, consultant has prescribed, he has said that you have to receive 1 dose of IV antibiotic, and after that we can send you home. But since the inflammation or your condition needs antibiotic, so it should be administered through your vein. So what I can do now is we can do this, and then you can tell the patient to lodge a complaint. If the patient wants to lodge a complaint, so you can send the patient to PAL's office, offer this, and arrange for root cause meeting and incident report form and all those things. Okay. Remember Buster protocol. Okay. Heart failure, talk to the son. It is the same that the FI2 in medical ward patient is 80-year-old lady managed for heart failure for the last 2 years. Talk to the son, address his concern. The son has now come in person. Before this, the son has been calling time and again, and he has been asking the status of her mother, that how is my mother doing, but nobody responded to his calls, and then you have to take the history from the son. You have to apologize and you have to take the history, and then you will be asking, okay, what times have you been calling? At what time have you been calling? Son would be very angry or upset. He would be saying that, okay, doctor, I've been calling for so long and nobody responded, and I want to lodge a complaint and all that. So you have to tell, you have to ask about that. What time have you been calling? And did you talk to anyone who was that person who you talked to? And can you please tell me the names and whatever? What did they tell you about mother? Did they give you any information? So we are going to investigate, and everything you have to do all those things that we are going to investigate. And if the patient says that I've been calling a late night or at that time, so you can tell that we are that the staff or the nurses work in the shifts. So all the time doctors are not available at the ward. Sometimes they are in the morning rounds, they are in the operation theaters in the evening, or they are doing ward rounds. So it is not feasible. So we will be looking into this matter, that what went wrong and what happened. So we will be open and honest, and we will get back to you. You can lodge a complaint with PAL's office and all that. You can offer that, okay? And then medication change, talk to a doctor, to the daughter. So here is FY, you are FY2 in GP surgery. 65-year-old lady had blood test done for hypothyroidism. Test results, TSH very low, T4 very high, which means she had hypothyroidism. Following the blood test, the GP reduced the dose of levothyroxine to 50 micrograms, and the daughter is supposed to be informed about her mother's treatment, talk to the daughter and discuss why the medication was reduced. So here angry daughter has come. She has been talking to you that, okay, doctor, why you have changed my mother's medication? So then you do the grapes and ask about, are you the next of the kin? Do you have any other siblings? Are you lasting power of attorney, or has it been written in the notes, or have you taken permission of from your mother, or has your mother assigned you, or your mother allowed you to be a part of her treatment, or are you the next of kin, or are you the carer? Okay, so you have to ask these questions. That have you made it clear to your mother that you would like to know change in her treatment? So you have to ask these questions from the daughter, and then you will say that the daughter will say that, yes, I have already made it clear. And then you will offer apology. You will say that, okay, I'm sorry, I can see from my notes that you need to be informed about your any change in medication. But could you please tell me that, would you like to know about every change in the medication, or any significant change in medication? And how would you like to be informed in future? And then it is, since it is medication change, it is not a very big deal. So it comes under non-significant even. So it was for the betterment of the patient. So you do not usually offer PALS, but if the patient is resilient, if the patient says that I want to lodge a complaint, then you can refer the patient to PALS office as well. Okay, so you have to talk to the daughter, and you have to address her concerns as well. And the next is let me see if she has any concerns. Yes, you can ask about social history, who is in the family, who lives with your mom, where does your mom live, and who else takes care of your mom, and also is your mom able to make her own decisions? This is, does she have mental capacity? Have you made it clear to your mom that you would like to know about her treatment? You would like to be a part of her treatment strategy, or and then questions, you will be asking the questions regarding the doctor's communication, that, okay, how did they communicate to you? What did they communicate every detail to you, or were only significant changes? Okay, and then how would you like to be informed in future? You need to ask that. And then next is clindamycin adverse effect. FY2 in acute medical unit. Patient is 71 years old who was admitted with cellulitis of the right leg. On the 4th day of admission, he developed diarrhea and abdominal pain. Stool sample was taken with tested positive Clostridium difficile. This patient was discharged by the discharge of the patient was delayed by 7 days. speak to him and address his concerns. Okay. So here is an angry patient. So he asks, he was given clindamycin. So you know that clindamycin causes pseudomembranous colitis because of pseudomembranous colitis, and he had diarrhea and abdominal pain. And then when stool examination was done, so Clostridium difficile was found in that. So he was given another antibiotic. Antibiotic was changed and his symptoms settled, his diarrhea settled, and he was discharged, but it was delayed by 7 days. So he's angry, he's getting angry. So what you are going to do is you have to follow the same protocol. You have to offer apology, ask what symptoms did he have and all those things. And then you have to tell, are you allergic to clindamycin? Did you make it clear to anybody? Has it been documented? So it is an adverse effect of clindamycin that it can cause it. You can explain it to the patient, and the patient will ask you that, okay, doctor, if clindamycin causes this adverse effect, why did you give me this antibiotic? And you can say that since this is the antibiotic, or this is the recommended or the most suitable antibiotic in this case, so that's why we have prescribed this antibiotic. So this discharge was delayed, he wants compensation. So you can say that, I'm sorry, can I get, patient would say that, can I get compensation for what has happened? So you can say that, instead of saying that I don't know, you can say that I'm not really sure whether you are entitled for any compensation in this situation, but you can get in touch with PAL's office or PAL services for more information. Okay. And he will be asking that, okay, are there not any other antibiotics to treat this infection? So you can say that we could use other antibiotics, but this is the standard or recommended antibiotic. And his discharge was delayed by 7 days. What you can do is you can offer him, you can give them fit note, which is renamed. It was a sick note basically, so it has been renamed to fit note. You can tell the patient that, okay, if you have problem or your work has been affected, so what I can do for you is that I can give you a letter saying that you have been admitted in the hospital for this much period or for this time, so you were under treatment. So if this has affected your job. Okay, so you can give the patient a fit note for this. Another similar scenario is clindamycin allergy. The patient comes, the patient was allergic to clindamycin and he was prescribed clindamycin, and you have to do this scenario the same. It's the same approach, and you have to take this scenario in a similar manner. Okay. Let me see if there are any questions regarding this. Okay, IV cannula in a child. Another scenario. This is FY2 in peds. You are FY2 in peds. 15 years old boy with cerebral palsy being managed for chest infection, treated for pneumonia. His IV cannula has been blocked, and the medical team have tried to set up IV line, which was not successful. Now the mother is refusing further attempts. The child is tachycardic and has running temperature. Talk to the mother about importance of inserting IV line and address any concerns. Okay, so this is a scenario where mother, she is getting angry or she is getting annoyed because doctors are coming and they are attempting to pass an IV line, but they failed to pass it. So mother is not allowing any further attempts. So what you need to do is you have to talk, you have to counsel the mother regarding this cannula. So you have to talk to the mother. You have to tell her that, okay, it is, you have to talk about the importance of the IV line. You have to tell the mother that, what do you know about, take some history and ask, what do you know about your child's condition? So she will be telling he has chest infection. Why can't you prescribe oral medication? Tell her that he is still running temperature and he is tachycardic. So it means that infection has not settled. So he still needs medication through his veins. That's why the consultant has said, so we need to pass this cannula. This is important for your child. So she will be concerned that it causes pain and multiple attempts have been done. You will say that we will be using a numbing agent to numb that place, and we will be using the smallest possible size cannula, and also we will be asking one of the most senior persons in the ward to start the cannula. Okay, so this is all about this cannula, and this is delayed. Mother is not allowing this cannula. This is not a which can be complained for. Okay, and another thing, the next is unhappy with the hospital management. So we have another approach. I think these three approaches are more than enough for today. We will be doing this next approach in the next class, that will be on Saturday. They are more or less the same approaches.